I've always been interested in health. I was like the first one to run to get a Band-Aid on the football field. So I know even as a young age that I was destined to do something in the healthcare. I had a ton of health issues as a kid. I had severe allergies. I had upper respiratory issues that never ever went away. And my father was a dentist, he took me to practitioners and all they gave me was medications to treat my symptoms without changing my diet, without getting rid of refined sugars, grain, dairy, and I was constantly sick. So as I got older and I got through high school and college and I decided to go into some medical field, I wasn't quite sure what I wanted to do. Long story short, I ended up pursuing chiropractic because as a non-drug therapy healthcare modality, that seemed to resonate with me because the drugs that I took gave me quite a bit of side effects and that's not the route I wanted to go. So I got into the school and the training to be a chiropractic physician was pretty intense. So there's 4 years of intensive biochemistry and neurology and orthopedics and you name it. And my passion for it grew every year I got through the 4 years. And so when I got into my clinical practice, I was pumped. I was psyched to do something that was non-drug, although we know drugs are very necessary to help people get through their crisis. I was just pumped to do what I was trained to do, which was resolve neurological problems and musculoskeletal issues for people. However, when I was going through school, I kind of got a little bored. And I said, there's got to be something more to this than just joint manipulation for musculoskeletal symptoms. So I did some research. I stumbled across some friends who said, some colleagues that says you should get involved in the functional neurology program or the new latest and greatest chiropractic neurology program that's out there through the Carrick Institute. And so for me, it's like I am a mechanisms, disease-knowing, hardcore science junkie. And so for me, it resonated to say, I was happy doing what I was doing in clinic, but I got bored. And so somebody turned me on to functional neurology. I was elbow lamp, head deep in studies for an additional 3 years to learn some intensive neurology because I wanted to fix more complex cases. I didn't want to just see your typical pain syndromes, musculoskeletal stuff. And don't get me wrong, that stuff is all important. But people that have pain syndromes also have neurological problems, also have chronic health issues, have hormonal imbalances, gut dysfunction. And that's kind of where I was going. So I don't want to say I wasn't satisfied with the original thought of being a chiropractic physician. It just wasn't enough for me. So I pursued the neurology and got addicted to it. And then all of a sudden my clinic was just neurology, neurological cases. And I was pumped because people were getting well. And what was really impactful as a chiropractic physician was how manipulation really worked. We're not taught that in schools. It's just, this is what it does, it's joint, and it was unbelievable to see a lazy eye improve or vertigo go away. So it was pretty remarkable. It was pretty exciting to transition from the old way of thinking in a practice and then having a specialized practice in neurology. Yeah, so my world imploded at a certain time when I was like booming in my neurology clinic now, and I said this, I've had a world of crap happen and drug addicts stealing from me, and I've told the story that my life fell apart financially, in a relationship, professionally, and like many people do, they don't take care of themselves. They almost forget to take care of themselves and almost disrespect themselves internally, their health, which is what I did. I drank too much to try to sedate myself to go to sleep. I drank too much coffee. I mean, it was unbelievable to try to get through my day, and I never really honored the truth for me to go and talk to somebody about all the crap that was happening in my practice at the time. So about 2 years later, when the smoke cleared, I started to lose weight. I was getting night sweats. My left pupil was the size of a Frisbee. And I went to a friend who was a radiologist. He took a picture of my chest and says, you have a 5-inch tumor in your chest. So the disease was non-Hodgkin's lymphoma. And I had to start that journey. So all of a sudden I went from general chiropractic to hardcore neurology to now I need to know everything about chronic disease and disease because I am a victor through it all. So my passion became very deep, and my mission to help others with chronic disease was really kind of sparked from my journey through cancer. And my research to understand why I developed disease then threw me into the realm of understanding how the mechanisms of all chronic disease develop, which they're all the same. And so during that period of time, I also developed a personal protocol to help me rebuild my health back to excellence. And so I applied it to myself, and 12 years later, I'm still in excellent health. And anybody that we've applied these principles in functional medicine to have also had just miraculous things in their health. And so my new direction is really, as I veer off into these different roads, it's like that's my home. Functional medicine and my personal journey through disease has become my home. A lot of people have said to me, it's like, wow, that's an incredible story. And I said, you have to count your blessings when there's a trauma. And anytime there is a trauma or something negative happen, look at your blessings. And for me, it drove me into a direction of really understanding why people get sick and different ways to fix people, if you will. And it's just, I can't get enough of it. I love it, and maybe my disease and this big fat tumor in my chest happened for a reason, but I love it. I love helping people with this new journey that I've gone through. My journey has given me a different perspective, a different set of lenses, that when someone comes in and they're ailing, or they come in with a truckload of files and no answers, I become the quarterback for them. And I think that the direction of the practice has become such that I understand what people go through when they are suffering with something, they don't have answers, or they have a major disease and they don't know what to do with it, or know how to treat it, or they don't have the know-abouts to find different practitioners to get them through their crisis. So the clinic now, and my practice now, really is just deep dives into human physiology to figure out what do we need to do for this specific person. We all can't wear the same shirt, ring size, or pants, so everything about what we do is very unique to the individual. It's unique to their genes, it's unique to their gender, their lifestyle. Everything becomes very specific. So the new functional medical model that we use in the office really is just a deep dive into people, and also bringing them into the equation. I mean, I think oftentimes healthcare providers negate what patients or people have to say for time, or they're not interested, and they poo-poo what people have to say. Well, you're the patient, you know what's happening in your body. We bring people in. I want people to be an advocate for themselves. So we really bring people in so they become an intricate part of their care. And the functional medicine clinic that we actually have now really is just a deep dive into people and including them in the journey so they can get well. I think one point I would like to make about that is developing our unfranchised business while I was going through crisis, building our retail and network base allowed me to create income so I could survive during my crisis. So I thank this business and company for allowing that to happen for myself. And nutrients are so important, and I think they're minimized. And what I see clinically in practice, you get your typical somebody come in and I heard to take this, and it doesn't really work that way. And the way that we use nutraceuticals and nutrients is really unique to the person. Should everybody take a curcumin? Yes, most likely. Vitamin D, OPC, some of the big hitters. Yes, I think so. But there's also the time or case or place where we really have to find out if nutrient therapy is appropriate to the person for whatever they have. Can everybody take a supplement? Absolutely, but it would make more impact if we actually knew their gene network, what was happening in the gene network with gene SNPs. What was their lifestyle like? Have they had children? Do they have postpartum depression? I mean, all those things in a person's history, patient history, it helps us guide in the way that we use nutrients. And nutrients are so powerful as long as they're used with intent and not just given to somebody because we hear that you should take something. So based on lab work, based on advanced blood work, stool testing, gene SNP testing, hormone profiling, something that we call the functional 4, is a way that we look at human physiology. And then we gear lifestyle improvements. People hate the word change, so we'll just say improvements. So lifestyle improvements, and then we create a custom nutrient plan based on objectives, science findings, and the person. Right? Sometimes we have to treat the person, sometimes we have to treat the labs because sometimes they don't match. And so we try to combine those with an excellent food plan, dietary recommendations, and certainly nutrients are a must for anybody to rebuild themselves from a chronic health issue. That is such a good question. I think I would have to tell them that learn as much information before you make a decision on any healthcare field. Now, I'm not going to say I'm more biased to the chiropractic world or being a chiropractic physician. I'm more of, in 2020, if you commit to being any kind of doctor, I don't care what kind of doctor or label you have, I think the commitment shouldn't be on a myopic therapy that you use or a modality or whatever it is that the label allows you to do. But if you commit to being a doctor, no matter what it is, okay, we'll say as a chiropractic physician, then one, commit to that process and do everything possible to resolve the person that's walking through your door. Because if somebody's got vertigo and dizziness and they have back pain, they have some other gut problem or hormone dysfunction. And it's just like someone going to a medical doctor and it's the same thing. Or somebody who's an ologist. Well, there's a lot of ologists out there, but it's a very myopic way to see things, and I only deal with this body system and this organ system and this hormonal system. The body is a complex network of systems. And so I would tell this newbie, young person to really learn about all the different facets of healthcare, and if they decided to become a chiropractic physician, then learn everything about it. Go way beyond the scope of what's being taught as a musculoskeletal business. And again, I'm going to say it again, if you commit to being a doctor, I don't care what kind of doctor you are, commit to fixing people. That's what we've chosen to do. Our oath, the oath shouldn't be do no harm. The oath should be do whatever we can to fix this person. And so I would encourage them and energize them to find what their inner grit is and what their mindset is, no matter what the profession is. There's so many different myopic healthcare professions, and I guess if I had a beef with just my profession itself, it's, can we just get off the thing that drugs aren't necessary, or musculoskeletal injuries, or adjust the spine and the body will heal itself? Yeah, there's an extent to that. But it's just like saying, medicine, we throw a medication at a pathology, which is the end result of, is the end stage result of some dysfunction. It's like, listen, we all have to hold hands and work together to fix people. And that's ultimately what people want. They want to be fixed. So to say, oh, I went to this person or this doctor, or I went to this car, or I went to this MD, it kind of gets me crazy, only because people are still searching for answers. And what ultimately do? They come out with a diagnosis from that practitioner and a diagnosis from this one, and nobody's being the quarterback, nobody's putting the pieces together. The human body doesn't work as a single unit. Systems don't work that way. It's a giant network. And so I just think as time goes on, hopefully the current chiropractic field, again being what I am in, transitions into working with all the other fields, just like I hope medicine transitions to working with all the other fields in naturopathic medicine and chiropractic and all the other. I mean, we should all be one. If you want to call yourself a label, cool, call yourself a label. However, if you commit to helping people, you go full Monty in fixing them, finding and fixing what's wrong with them. And that means pulling people in. If I have to pull in anyone, like I'm lost here, help me with this one, or I have a question. And so we actually pull people in as a team also, when we do get stuck. So I just think if all doctors had the mindset that our job is to fix people and do whatever it takes to fix people, we wouldn't have any bias, we wouldn't have any of these fights between professions, we wouldn't have any of these weird self-righteous wars. Our goal is to fix people and do whatever it takes to do that.